Hi, everyone. Welcome back to the Becoming Anchored podcast. So glad that you're with us today. I'm so pumped for this episode. Before we get into all of the content, I would like to just do a quick little intro and a disclaimer, and then we'll kind of jump in. So I'm Lauren Jackson. I'm part of a group practice in the Brentwood, Tennessee area. We specialize in the treatment of eating disorders outpatient, along with many other presenting concerns all through the lifespan. We're so excited to have this new platform to connect with you guys and reach you guys. A quick disclaimer for this episode and all episodes, all of the content here is really for informational purposes only. So it's not meant to substitute therapy or any kind of medical advice. And so if you find that as you're listening, you could benefit from therapy, I would so encourage you to reach out to someone local. If you're local to us, reach out to us. We'd love to connect with you and work with you. So I want to jump in. I'm so pumped. We've got a guest on the episode, the podcast today. We have Chelsey Medley. She is a amazing medical provider here in the greater Nashville area. She works. Well, I'll let her introduce herself and kind of tell you what she works with. But we love Chelsey so much. We collaborate a lot with her with our eating disorder clients and other clients. She really is a fabulous provider. Especially in that medical space. And so let's just kind of jump in. So hi, Chelsey. It's so good to have you.
Hi, thanks for having me. This is exciting.
Yes, we're so excited. So I'd love it if you could just maybe tell us a little about yourself, what you do, how you got to where you're at now.
Yeah, of course. So I'm a family nurse practitioner. I've been practicing for 10 years this year, which kind of blows my mind. Like you said, in the Nashville area, I've been in Nashville for about 7 and kind of stumbled into doing medical management for eating disorders and just generally kind of an empathic, I'm an Enneagram 2, if people are familiar with the Enneagram. So I feel like that fits my profession well, but I really enjoy treating patients with mental illness, even though I'm not like a mental health nurse practitioner. I enjoy treating those conditions too, and it's just part of primary care. So it's a lot of what I do.
Yeah. So it sounds like you as a medical provider have awareness around the impact of mental health on medical health, or how they're kind of like, we can't really separate them.
You can't. I think some providers do. Like I've heard many medical providers say that that's just not the kind of medicine they enjoy. And like in primary care, really in all medical conditions, you can't. They're not two separate things. Mental health impacts physical health. So many times I have seen physical symptoms from anxiety, stress, PTSD, over and over and over. So you can't ignore that or pretend like it's not part of the issue that are going on with people.
Yeah. I'm curious how that shows up in your daily practice with your patients, just in terms of how you're kind of having those conversations with your patients who are maybe, coming in for physiological medical things, and you kind of have the lens of medical and mental health on at the same time.
Exactly. So most people who come to me aren't saying, oh, my stomach hurts because I have anxiety. They're coming in, like you said, for a physical symptom. And it's my job to kind of tease that out and figure out, is this, what's contributing to it, what's at the bottom of it. And so I never just assume, oh, they're anxious, that's all this is. You've got to rule other things out, ask the right questions. But often we talk through their symptoms, which can kind of run the gamut. And I think more people are aware, especially like the brain-gut connection. And so many of my, patients with gut issues, really have a lot of stress in their life, or they're super anxious, they're depressed, they have trauma, and it manifests kind of with digestive symptoms. So that's always a question I ask. What's your stress level like? Have you felt anxious? Is there anything big going on in your life? So it's not where I go first. You know, you want to listen to the whole picture and not assume that's what's going on. But I think people are pretty open when you approach it that way, or it might have been in the back of their head, like, oh, could stress be causing some of this? And they're almost relieved to hear, like, okay, that's kind of what I thought. And now it's validating to hear this could be from stress for mental health stuff going on.
Yeah. Yeah. And then what do you do? Like, what's kind of your next step?
Always therapy. I don't know how many times I have said, like, I wish we were just assigned a therapist at birth. I think everyone could benefit from therapy, some more than others. But of course, there's access issues and not having the resources to pursue that. So I do some coaching and like mindfulness practices, stress reduction, kind of introducing, boundary work might need to be done, or there are things they need to be saying no to, getting their work life, family balance corrected. A lot of people are just overworked. And so many like anxiety, stress complaints are work related. And, if you're working 60 hours a week, I don't think there is any way you can feel balanced or well. It's just too much, I think, for almost everybody. So it's kind of introducing it, giving them some resources. I don't have unlimited time, but at least try to start that conversation of here are some things you could look at or pursue.
Yeah. Yeah. I love hearing that you start the conversation with some of your patients around mindfulness and boundaries. And I mean, I think a lot of us think of that as being like kind of a therapy space topic, but you having that mental health lens being a part of the holistic view of the patient, it makes sense that would be a part of how you even treat your patients. I'm curious, do you ever have any patients that come in who have had, and I'm sure you have, but who have had like a poor or negative experience with a previous medical doctor that wasn't also looking through a mental health lens?
Absolutely.
Yeah.
Yeah, so many people, especially people who have suffered with anxiety or depression a lot of their life, they get blown off by medical providers. They don't listen to them because they're just an anxious patient, or, if they don't have a proper perception of depression, they just don't care. They won't do anything to take care of themselves. And it's so damaging to people's health because they avoid medical care after that. Obviously. So they have a bad experience. They don't go back. Then they develop a ton of anxiety around going into a doctor's office. And they may delay preventative screenings and end up with real medical consequences of that negative interaction, which is, nothing makes me madder than that. But unfortunately, it's fairly common.
Yeah. 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 So I know that you're passionate about this like non-shaming, kind of trauma-informed approach to medical care, which lines up with that mental health lens that we've kind of been talking about that you also have on with your patients. The non-shame trauma-informed piece stands out to me as a medical provider because when I think of a medical provider, a doctor, my family doctor, I'm not going into their office thinking that they're trauma informed, which is okay with me because I don't necessarily, or which I can handle or deal with because I don't necessarily have a very massive trauma history, and so I can stay relatively regulated and whatnot. Especially if that is true that they are not trauma informed or are not like, I'm not experiencing that from them. But I'm just curious, because I'm sure a lot of our listeners, can probably resonate with like, yeah, I don't really think of my PCP or our pediatrician is necessarily being trauma informed. So I'm curious about how that is part of your daily practice. And then if you could also speak a little bit more to what does it mean for you to take a non-shaming approach to your medical care?
Yeah, I think first there just has to be that awareness of how past trauma is going to impact them physically, mentally, how they're going to hear what I'm saying, if they're going to trust me. Like establishing, a relationship can be harder because of what someone's been through. And I think I just stumbled into it. I don't know that I really got specific training about trauma. I think I'm just generally empathetic and try to put myself in someone else's shoes. I understand like the privilege I have had in my life and that's not a lot of people's experience. And then just through, treating patients for 10 years and hearing people's stories and it's really impactful. There is good data now too. Well, some data coming out about the impacts of like your ACE score, so your adverse childhood events impacting health, even from developing heart disease, diabetes, the things we think of like substance use or mental health issues, but really other more physical impacts as well. So I think you've got to be aware of that. I see a lot of chronic pain in trauma patients, headaches, digestive issues. So again, it's not, you don't want to just blow things off or label it, but also this awareness of like this could be part of what's happening too. And you've got to address trauma or likely your pain may not improve versus avoidant behaviors, pushing it down, not addressing trauma that you've had.
Yeah. Well, we know that the most important thing to a trauma-informed kind of approach is safety, which is, obviously what you mentioned is so important to you. And that, like you said, you've learned over all of your years of sitting with clients and their stories or patients and their stories is that they all need safety with really whatever they're, coming in with physically and then maybe also emotionally as well. So does that feel, does the non-shame approach feel similar kind of, I guess, in line with the trauma-informed piece as well for you?
Yeah, I don't think shaming patients is productive or effective. Like that, at the end of the day, it's not going to produce better health outcomes. If I'm not generally a judgmental person, so I think I'm just kind of in that zone anyway, but also understanding that that's not productive or helpful. And unfortunately, I do think some medical providers do think it's helpful, and I've heard occasionally even patients saying, no, you've got to fuss on me. You need to fuss on me to like get me to do right or, exercise, take their medications regularly, whatever it happens to be. But I'm like, well, you're not going to get that from me.
Yeah. You've had patients say that to you. Mm-hmm. Oh, wow.
Yeah. Mm-hmm.
Wow. Because we're just so used to that.
Yeah. It's really interesting when that comes up where they assume I'm going to fuss on them because their blood sugar went up or their weight went up or, any other factor. And, so many people are just in different seasons of life and you never know what people are going through, what they're experiencing. So yeah, taking that shame approach of I can't believe you're not exercising 5 days a week, or it's more like, okay, well, what's life been like? Oh, your mom's on hospice and you're a single mom and, of course you're not exercising 5 days a week. That's not the priority, nor should it be. So I think it's really like just listening to people and asking them questions, figuring out what their deterrents are to having, I don't know, say having better health, like that's in people's control all the time, but it's often, being healthy also has this moral implication of like, oh, if you're healthy, you're good. And if you're not healthy, you must have done something bad to get there. And I don't love that either. So it's more about what does that mean to them? What's well-being mean to the person in front of me?
Yeah. I think that's such a perfect example of how mental health and medical care intersect because, in the therapy space, behaviorally, what we know is that shame does not produce effective change. It actually does the very opposite. Though we keep shaming people all the time, right? And so I hear you wanting it and trying to, be a part of this movement that is moving away from that type of change approach, which I think in the mental health space, there's perhaps like an element of us having moved past that, but it seems like sometimes in the medical space, it's still sometimes not right. Yeah. Yes. So I just I keep pioneering that trail because we need it.
Yeah. Well, maybe if more medical people would go to therapy and do their own work, that will be helpful for the world in general.
Yeah. So I know earlier you spoke to your kind of specialty as well in medically treating eating disorders. And so I'm curious, that's one of the populations that here at Anchored, we treat a lot and work with a lot is from the mental health side of things is eating disorders, disordered eating, body image concerns, maybe people who feel like they're really stuck in diet culture and whatnot. I'm curious from a medical perspective and your medical lens, what are some of the nuances to treating eating disorders as a medical provider?
Yeah, well, it's very complicated and it requires a team approach. Like I definitely can't treat an eating disorder on my own. So I so appreciate when a patient's able to have a team, a therapist, a dietitian, preferably like a mental health psychiatrist or nurse practitioner it kind of takes a whole team. I feel like to move people forward in outpatient treatment. In primary care, it's tricky because this is really like a specialty niche where they need a lot of time, and primary care is more just moving people through, a sore throat, diabetes management, you throw an eating disorder patient in there and it's complicated and more time consuming. But rewarding and much needed. Their medical complication risk is so high of electrolyte imbalances, monitoring blood work. We do blind weights when we can. If a patient's not having that done with their dietitian, we do blind weights in the office to monitor that. Orthostatic vital signs is something eating disorder patients need, which is just where you check vital signs laying, sitting, and standing, but takes a little extra time. You've got to know to do that and look for really subtle changes because eating disorder patients they can worsen really quickly. Their labs can change very abruptly. So often everything's normal. When we check their labs, it's normal and their vitals are normal. And they see that and go, see, I'm fine. I don't know why everyone's so worked up about this because that eating disorder loves to tell them that they're not sick. And so just having to reiterate that, just over and over and over, like, yep, your labs may be normal, but that's one moment in time. And the next time you purge or over-exercise or restrict all day, they may not be normal after that. And just getting across, like, how sick that person is and how dangerous their behaviors are.
Mm-hmm. I'm curious, how often are you seeing a new patient who has an eating disorder? Like, what does the frequency look like for you?
Yeah, so often, especially in the beginning when I started this, you guys were sending patients to me. So they kind of had their team and I was just the medical piece. And then as I got into that and learned more and more, I was identifying issues in patients who didn't know anything about that I did that and were just coming in for a new patient appointment and picked up on it. But I will say disordered eating constantly. Diet culture abounding. That's all the time, weekly for sure. A true DSM-5 meets criteria for an eating disorder. I see probably 5 to 10 eating disorder patients a week, but new patients probably a few times a month that I'm really pick up on a problem.
Yeah. Yeah. And how often are you requiring your eating disorder patients to be seeing you?
Yeah, it really varies on their behaviors and the level of support they have. Sometimes weekly. We'll have patients that really need to go to treatment, can't or won't for whatever reason, so they need to be monitored more consistently. Others are checking in with their team regularly, so I'm just kind of like, hey, I'm here. If things change or something comes up, check in sooner. Otherwise, I'll see you once a month or every 3 months, just kind of depending on where they are.
Mm-hmm. Yeah. Yeah. So, I know that you practice from a health at every size lens, right?
Yeah.
Maybe some of the people listening have heard of this before, know a lot about it. Maybe this is the first time you've heard of health at every size. So, maybe could you speak to that just a little bit, and then how you practice from that lens? Because I know that's probably part of your non-shame approach, right?
Yes. Yep. I don't know how you could treat eating disorders and not get to the health at every size lens. I hadn't heard of it before, and the eating disorder treatment is what drew me in. And I realized, I know I did a lot of harm early on in my practice because I had no eating disorder awareness. And, we're taught in school diet and exercise for all these conditions. And so I for sure gave that advice for a long time, and then realized, it was the same story. Like people would, I tried, I did really good for a few months, and then, something happened and I had lost some weight and I gained it all back and then some. And now we have so much data showing that's normal. That's what happens when you go on a diet. They don't work. There's not a single study about a diet that works long-term for weight loss. So even if you're assuming weight loss is good, we have not had a way medically that was actually effective. And so in my practice, it's about not assuming things about people's health because of their body size. It's not bringing their weight up necessarily, unless they bring it up or want to discuss it. Weighing people backwards if they want to, or not weighing them at all if that's their decision, and not pushing back on that, but just recognizing you can be healthy and be in a bigger body. That's a real thing that can happen, and does all the time. And it's game changing. Most of my patients who have had traumatic medical experiences, it was weight related.
Yes.
So often.
Yes.
They came in for a sore throat. They were preached to about their weight. Everything was blamed on their weight. I've had patients who had rheumatoid arthritis that went misdiagnosed. For 20 years, they were told, if you would just lose weight, your knees would stop hurting. And I did blood work. Rheumatoid arthritis, it's an autoimmune disorder that they now have irreversible joint damage because these assumptions were made about their body for that long. It's just disgusting and horrible and needs to change.
Yeah. So I would imagine that's when we talked earlier about, do you have patients who come in who have had a negative experience with a doctor in the past? That's probably
all the time.
A lot of what it is. Yeah.
So much. Yeah.
Yeah. So, as we kind of start coming to the end of our time together, I'd love to hear from you, your thoughts on, so, if we have any listeners out there who are like, ooh, maybe I need a new doctor after listening to this, what would you what would be some things that you would encourage people to look for when maybe they're trying to find a medical doctor who will care for them well, holistically, with no shame, trauma-informed, mental health included, and all of that?
Yeah, I mean, it's so hard to know until you're in a room with a medical provider, but reading reviews can be helpful, and reading their bios. Like most providers will have some kind of a biography on their website, and so if you get a lot of diet culture words coming out, like they do weight management, obesity management, I would, that's kind of a red flag, but it's really hard to know until you're in front of someone. Just, are they going to listen to you? Are they open to hearing your perspective? If you don't feel listened to or you feel blown off, I think just move on. There's a lot of medical providers out there, even though primary care is tough. Access is not great. There's long waits. I would try to find someone good, someone recommended either by word of mouth or who have a ton of good reviews or a really long wait for an inpatient appointment, like that's a good sign that they're probably
That's how you know they're good. Yeah.
Yeah. Just get on their list. Get on their list. Even if it's 6 months away, 8 months away, just make the appointment. It'll be here before you know it. If you need a walk-in clinic or establish with someone else in the meantime, at least you've kind of got a backup, a plan B.
Yeah. Yeah. So I love this idea of like, you can go to an appointment, see how you feel in the room. If you don't feel good, find somebody else. Like you have permission to find someone else. Yeah. Yeah. That's good.
Absolutely. Of course, not, insurance companies rule the world still in that way. Got to be a network, but outside of those factors, look for someone else.
Yeah. So Chelsey, where can we find you? Where do you work? Where are you practicing?
So I just started at a new office, Cool Springs Internal Medicine and Pediatrics.
Great. So do you primarily see adults, or do you do pediatrics as well?
No, I mainly do adults, especially for eating disorder stuff.
Okay. Okay. Adults. So 18 and older. Okay. Awesome. Good to know. Okay. Awesome. So we always end each of our episodes with a little affirmation and some homework for our listeners to take away. We kind of like to mirror what sessions might kind of look like, even though this is not therapy, but we do love to give our clients and now our listeners something to take away with them, to chew on and have with them throughout their week. So my affirmation from you is that you deserve non-shame, trauma-informed medical care where you feel seen, heard, and cared for, which is really just the theme of what we talked about today. And I am fully confident and know that Chelsey gives that care to her clients because I've shared clients with her. And so I know that for a fact.
Thank you.
And so my homework, and just like Chelsey said, if you're listening and you're like, oh, you kind of have like a gut little reaction, like, do I need to find a new doctor? Like I had this experience and maybe that's a red flag. I would encourage you to maybe like reflect on that and perhaps do a little bit of research and see who's in network with your insurance and read reviews and maybe go find a new doctor if that's what you need to do, and give yourself permission to go to an appointment, see how you feel in the room with them. And if it doesn't feel good, kind of go back to the drawing board. You have permission to do that. So thank you so much, Chelsey, for joining us. This was so great.
Yeah, you're welcome. Thank you for having me.
Yes, amazing. Well, I hope you guys have a great day, and thanks for joining us on the Becoming Anchored podcast.